This is Dr. Vulcano. Doctor, thank you for your time today.
Thank you for having me.
Of course. You've got a foot in your hands here. Tell us, what are we talking about today?
So today we're going to be talking about a bunion deformity. What that means is that this bone, called the first metatarsal, instead of being nice and straight, over time can start to swing inside. And as it swings, it creates this painful bump and prominence that can be uncomfortable, especially in tighter shoes.
And what can people do about it?
You have a conservative approach, or rather a non-operative approach. You can use a toe spacer that keeps the toe straight, a bunion sleeve. It's a silicone sleeve that you can apply over the bony prominence to pad the area. And of course, you can use wider toe box shoes. Otherwise, you have a surgical approach to correct the deformity.
And once the surgery takes place, is that a permanent fix?
Yes. Overall, it's a fairly successful procedure with a relatively low recurrence rate.
And what does the procedure look like from the patient's perspective? What should they expect if they're looking to do this?
Currently, there are about 200 different types of bunion surgeries. The one I specialize in is a minimally invasive surgery, which I pioneered in the United States in 2017, where through little tiny keyhole incisions, we cut the bones and we realign them straight.
What would you say to the person who is in a lot of pain because of their bunion, but they're like, surgery sounds like a lot, I don't want to deal with it?
With the minimally invasive surgery, I really have a lot of patients that say, you know what, had I known it would have been like this, I would have probably done it years ago. I have other patients who many years ago had one side operated on with a traditional surgery, and now they just can't tolerate the pain on the other foot, which they put off for years, if not decades. And when they do the minimally invasive surgery, saying, oh my God, this is night and day compared to what I had done in the past.
Great. Well, if people would like to learn more, how can they?
They can either visit our institutional website or give us a call, make an appointment.
Great. Well, thank you so much for your time.
Thank you so much for having me.
You got it.